Hello everyone. Let us discuss about aphorisms 22 to 25, which finishes your first year syllabus, right? So application of knowledge of medicine to knowledge of diseases. Now we have knowledge of disease, we have knowledge of medicine. Now how to apply this knowledge of medicine to knowledge of disease has been told over here in brief. So disease expresses through totality of signs and symptoms. How will you come to know that it is a disease? That is, it has got an expression through signs and symptoms. When a patient comes to you with signs and symptoms, you'll come to know that he is having a disease. Now, you have a knowledge of medicine just through proving. The medicines are the one which have got the tendency to produce morbid symptoms on the healthy human beings. Now, medicines only become remedies when they annihilate the symptoms, means when they cure the symptoms of the disease. Medicine which has got greatest tendency to produce similar or opposite symptoms can be used for removal of symptoms. We have got a disease, we have got a medicines. Medicines are of two types. They can produce similar symptoms or they are able to produce the opposite symptoms, right? So these are the two kinds of symptoms they can produce and can be used for curing the diseases. So here he talks of three systems of medicine. One is allopathy, antipathy and homeopathy, right? So what is allopathy then? He discusses in footnote. Already we have seen in first aphorism that how they were curing during those days. Allopathy does not have any principle. It is also called as heteropathy. Means like according to the whims and fancies of the physicians of those days, they have started giving the medicine wherever it could hit, they continued with it. But sometimes they were very cruel methods of medicine, and they had no explanation for that, and they had no alternative for that, and they never wanted to change the mode of their treatment too. So that is what is called as allopathy. For example, when there was a fever and they'll remove the blood from the body because the person is looking red, thinking that there's more blood in him, so he has become red. So that was the thinking of those people. That was the reasoning of those people. Hence, they would remove the blood from the deceased person, right? And then what they would do? Issues and set-ons we have discussed. If the person has got pain in the knees, they would think that there is some foreign body accumulated in the knee. How to get that foreign body out of the body was they will make ulcers in the foot and they will maintain that ulcer and they will think that this disease will go through that hole like. So these were the thought that disease is material in nature and you remove the material from the body and the disease will be gone and health will be restored. That was the feeling and that was the thinking they had. Allopathy is very dangerous because they give violent medicines and which are prescribed on the basis of hypothesis. So other examples of allopathy are increasing the sweat, inducing bleeding, already I talked about this, increase salivation, and all what these things are doing when you are increasing sweating, increasing bleeding, increasing salivation, thinking that this particular thing is more in this person, after removing person is going to be all right. But this is very dangerous. This decreases the strength of the patient and never achieves the cure. Okay, that rather it causes more harm. So now, let us see about antipathy. So antipathic system of medicine is, as name itself is suggesting, it has got a principle of contraria contraris curenter. That means you are applying contrary, means you are applying antis to the disease. So disease is being produced like this. For example, patient is coming to you with the chills, you are giving some medicine which is producing heat. So exactly what symptoms are there? It's opposite you are trying to give the medicine. Antis will give you immediate and flattering results. In summer, if you have tea, when you feel your throat is dry, you will not have thirst for long time. But whereas you drink cold water, again you feel like drinking. Means the thirst will go on increasing. This is what happens when you are applying antipathy. Means the symptoms you feel immediately you feel the relief, but when the symptoms will come back, symptoms will again come back, but when they come back again, they will be in a more higher intensity and frequency also will be increased. Let's talk about homeopathy. So now, as we all know that this is a system, after a long period of thinking, Hahnemann comes to some logical system of medicine, that is homeopathy. Hence, he is very proud of the system, and he wants to tell that only homeopathy can serve mankind in the best way. That allopathy, what he is talking about, that allopathy is not existing today. Medicine has become more refined now, right? So, but homeopathy itself has got its own place, and homeopathy was best then also, homeopathy is best now also. As you go on practicing, you'll come to know how homeopathy is best. And now let's see that why homeopathy is best. Pathogenetic effects of the medicines are known from having them tested on the healthy individuals, and we are prescribing the medicines based on totality of symptoms. When we are considering totality of symptoms, as already we have discussed in 7th aphorism, we are considering disease in total and we are removing the disease in total. When we are giving medicines to the patients, we have tried them on healthy human beings and then we got the symptoms. Okay. So now we are applying the medicine on the basis of similarity of symptoms. But you have to be very careful. The similarity of the dose and similarity of the potency along with similarity of the symptoms is very, very important to have the ideal cure. Hence in homeopathy, to cure, similarity of medicine, potency, dose have to be matched and prescribed. Old school boosts complex prescription, it causes harm. They have a kaleidoscopic theories, means ever changing theories. Homeopathy is based on the nature's law, having fixed principles. But whereas in allopathy, you don't have any fixed principles, and 22 to 25 aphorisms usually is not that important for exam point of view. But they do ask what is antipathy, what is homeopathy, what is allopathy for 3 marks. Okay, thank you.